How big a problem is the Delta variant, do you think?
It's a very significant problem. So we've seen that it's more than 90% of cases in Britain. We're seeing it's growing in prevalence very quickly in Northern Ireland and in countries around Europe. The information is still coming in. We're watching the UK very closely, and the exact numbers are moving around. But what we know about the Delta variant is it seems to be a lot more contagious. It seems to be significantly more severe in terms of the risk of being hospitalised, and it appears to be less susceptible to vaccines, certainly in terms of just having one vaccine dose. So it's a very, very serious variant.
Is it going to be the dominant variant pretty quickly? Is that what your understanding?
What the experts tell me is that variants like this, which are so much more contagious, inevitably become the dominant variant, as it has in Britain and is rapidly becoming in several EU countries. So really the question for us is what needs to be done to make sure as many people as possible are fully vaccinated, because certainly the science would suggest that it is inevitable that these more contagious variants become dominant.
I see, for example, in my own hometown of Dundalk, there's a new walk-in centre established. There's lots of places we're hearing stories at Lone as well of the Delta variant taking hold. Is that your understanding from around the country?
Yeah, there are. And can I just say on Athlone, now that you've mentioned it, so the public health message is that for people who were in Athlone socialising by the river, on the west side of the river on Friday, the 11th of June, if they were there and they think they might have been exposed, to please just go to one of our HSE walk-in testing centres, and if they're symptomatic, to isolate and contact their GP, and their GP can organise a test for them. The public health response has been quick and localised, but I think, as always, Shane, the public health message is the same, which is this disease is rapidly evolving. The vaccine programme is being hugely successful, but we need to keep looking out for each other, minding each other, and following the good public health guidelines.
Are we now at a stage where it's 50-50 whether we will fully reopen the economy, indoor hospitality, for example, on July the 5th? Is that 50-50 at this stage?
What we need to do is we need to hear from NPHET, and we need to hear the public health advice next week. So we have an approach in place. It's the same approach we've used each time we've done an opening up. Last month, the public health advice was that actually Ireland was doing better than expected, and so we were able to open up quicker. The public health team are watching the Delta variant very, very closely, and we'll see what the data says next week. To give you a sense for how quickly this can move, Shane, just last Thursday, I was talking to the team after NPHET, and it was believed that the Delta variant was about 5% of new cases. And in fact, the data we saw from whole genome sequencing was that the number of new cases of the Delta variant was actually falling week on week, that it had peaked about 4 or 5 weeks ago. But then new information that's come in just in the last few days shows that it could be up to 20% of more of cases. So it's a rapidly evolving situation. So what we need to do is what we always do, which is let the scientists, let the public health doctors do their thing. Let's let them pore over the analysis.
And when will you make the decision
and then come to Cabinet
on the reopening?
Cabinet and the COVID committee and NPHET will be meeting through next week on exactly those issues.